On this episode, canaries in the mine, boner pills, orgasms, oh my. Welcome back to the Limitless Male podcast. I'm your host, Jess Goldoni. In this special episode, we're sitting down with Matthew Tompkins and Dr. Lonny Miller from Limitless Male, where we answer all of your burning questions. Everything from canaries in the mine to orgasms and going too long. I know Dr. Miller and I had talked about, especially in med school, and they say it with women's health too, but you have maybe one credit hour on men's health?
Well, you know, I've jokingly said, I don't know to you, or I mention it so frequently, that if I chose the wrong time in medical school to get up and use the restroom, I might have missed everything there was that they were going to teach me about diagnosis and treatment of low testosterone.
And nutrition too, isn't it similar with nutrition? I think there's like a very small window of anything that you're educated about nutrition.
How your food actually helps.
Which hormones and nutrition are the two biggest things that matter the most.
So when it comes to issues like testosterone replacement as a concept, in medical school, we're not really taught much in-depth knowledge about the therapeutics of testosterone. And then if you look at the specialties that get any training in it whatsoever, it's not something that is covered to the extent that it needs to, or with the updated information.
Right.
So one of the, I wouldn't say the dirty secrets of medicine, but one of the commonalities in medicine is often we encounter something in the clinic that maybe we don't have solid understanding of. So when we step out to get everything prepared for you, often we look up things like anybody else would in any other profession. If I'm seeing somebody with in clinic with an infection that I don't encounter very often, well, I know what the infection is. I know I need to treat it with an antibiotic, but I may not be 100% sure on which, or maybe I do know, but
or maybe there's something
it's
new.
It's so long that
I
prescribed it, I don't remember the dose or the interval. Mm-hmm. So I'll step out and use a companion app or book to look it up quickly so that I choose the right antibiotic, right dose, and all that for the patient. And then I'm off to my next room, confident that I provided great medical care. When it comes to testosterone, we're great. When somebody walks in, a man that, you know, I'm tired, I don't have much energy. Unfortunately, a lot of docs default to, well, you're 40, what do you expect? Or you're overweight, you need to get some exercise. You need to eat better. Well, what does that mean? Well, I don't know. They didn't teach me much to give you much guidance in that area. Or you need to get better control of your diabetes. There's always an excuse. Or even if you ask, can we check my testosterone? My experience, a lot of docs, because they're not at all familiar with that topic, dismiss it. Or they say, yeah, we'll add that into the rest of the labs. So what happens when it comes back, let's say in the 200s, some docs say, well, it's in the normal reference range, which doesn't necessarily correlate with
how do you feel?
Yeah, the diagnosis or at all with symptoms.
Right.
They'll say, well, it looks fine. I've seen a lot of people come into me with low testosterones that were assured by their previous doctor or provider that looked to be in order for your age. Well, that's simply not the case.
Right.
So, and then if you go the next step and you push that doctor or provider on treatment of that low testosterone, saying, look, I have low testosterone. According to the American Urologic Association, it's even below the cutoff in their guidelines. So what are you going to do to treat me? Well, often that doctor is going to walk out of the room, quickly look up an algorithm in a medical resource and order what it says. And it'll be a testosterone shot, every 2 to 3 weeks, which is still what's in the literature, but is not how we do it.
But medicine knows that it's out of your system within
5, 6 days. Well, not for every single one, but for most.
It's simply not going to last that long. And when I practiced conventional medicine and I didn't have the more in-depth knowledge and training of testosterone or hormone optimization, if you will, that's what I did. Is I followed the algorithms that said a shot every 2 to 3 weeks. So I would always have men come in. They say that first week I felt great, but then it dipped down.
Yeah.
Mm-hmm.
And I never thought that, well, maybe we should just do these shots weekly. I just followed the algorithm. And you're going to find that most of the physicians are going to follow that antiquated thinking. So you're not going to get the level of care or the level of competency that you would at a men's sexual health clinic like Limitless Male.
The medical community, unfortunately, patients, because of just how many patients doctors see and what they do and what kind of training they have and what kind of specialization that they don't have, we have to be our best advocates. We have to do the research. We have to look into that. And they've been telling women that for years. I mean, I don't know if you guys, we were talking about sexual treatment earlier, but you remember the treatment for female hysteria?
Oh, yeah. It was like, it wasn't that thing that stick up your nose and like,
no,
or was that a different
no.
The lobotomy, right?
They literally gave women orgasms in the exam rooms because that was the treatment for female hysteria in the however many. So women kept going back for treatment because it was manual stimulation to have a. And I see him nodding, so I'm not.
Who gave him the orgasms? Was it
the doctor?
Oh, really? Wow.
Yeah.
I don't know. Are we sure
and
this
got
wasn't
paid for it?
Are we sure this wasn't just a really good scam come up with by one doctor who's like, you're not waking up, folks?
No. I mean, it was a widespread treatment
Wow.
for female hysteria. Like if the woman was off or if she was too emotional, if she was too manic or if she was depressed. Oh, well, she needs to go get this.
Fascinating. I did not know that.
We frown upon that now.
Yes, that is frowned upon now, but it's very interesting to see how we've kind of gone, full circle. But back then,
it's a valuable at-home treatment.
Yes.
Yes, it is.
Works great for anxiety.
Maybe try that first and then come in for medication. But I mean, every woman was hysterical. Everything that we had, it was hysteria. It wasn't hormones. It wasn't menopause. It wasn't anything else until they started discovering it. And so I think men's health is having that same revolution is a way to think about it.
I'm glad you brought that up. Yeah, that revolution, the democratization or liberalization of health knowledge.
Yeah.
That's a trend that I've seen explode over the last year or two. You mentioned women have always been a better advocate for themselves.
I'm not saying better. We've just been told that we have to advocate for ourselves.
Yeah, exactly. An earlier advocate, but also a better advocate. Really, in the past 10 years, you see a rise in women that are more comfortable talking about menopause and treatments.
And perimenopause.
Right, and treatment of the perimenopausal period that before they were just sentenced to go through the hot flashes, go through the change, and that was just part of life. But now that's so easily managed that you see the younger generations of women coming in and asking, now what can we do? Or they come in armed with specific knowledge. And interestingly, those women are applauded for being their own advocates. But on the flip side, when a man comes in and says, I feel like I've lost my mojo, I'm having troubles in the bedroom, I'm tired.
Suck it up.
Suck it up, be a man. They're not told to be advocates for themselves, or when they do come in and bring up the concept of testosterone, because most doctors and providers aren't comfortable with the topic, they'll poo-poo it, dismiss it, greet them with hostility, or tell them go see somebody else about that problem. So, and I've seen this time and time again over the past year or two, where my patients are starting to challenge providers with better and better questions. So just last week, I had somebody come in and ask about the difference between magnesium glycinate, magnesium malate, and magnesium oxide.
Thank TikTok for that one.
Right, for the treatment of their magnesium deficiency.
Yes.
And me 5 years ago would have been very challenged by that question, but because of TikTok,
TikTok is a big
the
one on
Facebook
that one.
Reels, YouTube, I know what patients are going to come in with, so I take the time to bone up on the information so that I can have a better response. So through their advocacy, I've become a better doctor, and I can provide better medical care, and they can get better outcomes. So when men come in and they finally have the guts and the confidence to bring up their testosterone, those doctors who have taken the extra time to become more competent on the issue will provide better care for that patient. But I'm not seeing that in men's health. But that's why we exist at Limitless.
I've noted, and I don't understand with traditional healthcare, like my family physician, like why they aren't getting into these new things, because obviously I mean, Limitless is proof in and of itself that there is money to be made in this. It's a business from what I hear, and it's doing well. I don't understand their unwillingness to adjust, and it's only prescribing the pharmaceutical medications. It is interesting to me. I've noticed that I find myself recommending with fervently.
You're an evangelist.
I recommend fervently, don't go to your doctor. Go to a clinic because you're going to get more information out of the labs they do there. They're going to know more of all these different intricacies that your doctor's just not going to pay attention to. And, you know, I've lived that, and I'm still living it. So, I mean, it's just...
I wonder if, talking about the democratization of healthcare information, I wonder if we're going to get to a place where it's all specialists. Because your primary care physician sees your grandmother, your grandfather, your mother, your dad, yourself, your kids... they have to see everybody, and they concentrate on the main diseases. So your heart, diabetes, you know, cancers, things like that, screenings, wellness, vaccinations, that sort of thing. So, I mean, they're busy doing all of that. And so I think that that's why Limitless and Trillion and, you know, dietitians and all of these things exist, because you have the people that are specializing in those. And I think it is, you go.
Well, in general medicine, in primary care, if you will, there's something new coming out in many areas of medicine simultaneously. New things in the treatment of heart failure, diabetes, new vaccines coming out. It's a lot to keep up on. So as a primary care doctor, you're struggling to keep your head above water, seeing as many patients as you do on your schedule and trying to provide good medical care.
Right.
So when you talk about something like testosterone, unless it's a specific interest area of that doctor or clinician, they're not going to bone up on the new information, because there are very few new medications. There are for the treatment of hypogonadism or low testosterone. But there isn't much of an incentive to get that extra knowledge, to get the extra training in it, because it's not necessarily something that they encounter a lot in a primary care practice. So that's where when you go and find a physician with a special interest, like I have in men's sexual health, that you're going to get better quality of care.
Right.
And that's how clinics like Limitless Male have carved out a role in healthcare, is because we've taken that upon us to be the experts in men's sexual health.
Can I ask a question that's not on your list?
Yeah.
But I guarantee you right now it will get the most clicks. Can taking what would you call not the Viagra, the sildenafil?
Just say Viagra, Cialis.
Okay.
Yeah.
Taking a Viagra, Cialis, or like the daily, can taking a thing that helps you have a more blood flow make your penis bigger?
No.
Over time,
well,
because if you have more blood flow, it's extended out all the way, right?
Right.
Whereas
so
it wasn't
will
before?
Exactly. I guess I will put a little asterisk with my answer.
Limitless Male can make your penis bigger. That's what I'm trying to say, guys.
I'm not saying we can, but I'm not saying we can't.
Correct. I'm going to let you answer the full medical part of that, but it is proven that when you lose weight, your penis gets larger.
Maybe that's what happened to me then.
It appears larger.
It appears larger.
Right.
Less weight, larger. Yeah. We also have other treatments as far as using the penis pump to get more circulation down there. But go ahead. Taking those long term, can it make it look larger or be larger?
Well, if you're not used to having regular full erections, then when you do have an erection, it's going to not be quite as long or quite as girthy as what it could be. So when you do get on a daily medication or use an as-needed sildenafil or tadalafil on a semi-regular basis, by improving blood flow, that the penile tissue is going to respond. It's going to get girthier and potentially get longer, but it's not going to get longer than it ever was or girthier than it ever was.
There's a limit.
Right. So think back to what it was when you were in your teens, 20s, when you're at your full mast, if you will. You can potentially re-achieve that.
I like this one based on your magnesium question, because that's totally TikTok, because I've seen it.
Right.
The different kinds that you just pee out or that just are a laxative. They don't actually do anything.
And
for
I look
you.
really smart, but really I just watch more TikToks.
Right?
So when they ask the question, I have far deeper TikTok knowledge.
Exactly.
In between dance-off videos.
In between dance-off videos. Well, now
Yeah.
you can be your own TikTok doc video. So the question is, how do I know if my supplements are actually doing anything or just expensive bright yellow pee?
Yes. Is the answer. So
like the when they have like a drug and then they have the drug that isn't a drug that they take.
Placebos.
The placebo
effect. So supplements, how do you know?
Okay, so by and large, there are some supplements that are water soluble. So if you think of a lot of like exactly your B vitamins, for instance, vitamin C. If you consume a little too much, you're just going to pee out the excess.
Flush it out.
Right.
Bright yellow pee.
Exactly.
Okay.
There are some that are fat soluble that get absorbed into the fat and will stay into the fat and can rise to a toxic level. So most commonly encountered would be like vitamin D. Now, in especially in this region of the country where we're not getting a whole lot of sunlight, you're not going to encounter a high vitamin D level very often as a clinician. When you have a good dose of vitamin D as a standalone supplement, but you also take a daily multivitamin that has maybe 200% of your daily allowance of vitamin D. Then you're drinking your vitamin D supplemented milk or fortified milk, and you get vitamin D from this other supplement. It's that total daily dose that over time can make a difference and unfortunately rise to a toxic level in some people.
So research is what you're telling me.
Right.
So, and make sure I don't overdose on fat soluble type supplements. But so what I'm doing right now as a woman, and so I'm sure men are too. What the heck supplements should I be taking in my 40s?
Yeah.
Like, I know I've been told vitamin D and calcium. Or
B6, B12.
I do all the B complexes. I do a probiotic. I do a magnesium. I don't know which one. I've alternated between several of them because I don't mind all of the effects. But so what would you tell a guy that comes and sees you? What are the top things that is it just a multivitamin?
What's going to move the needle the most?
Like what is,
That's a great question. And a good age-specific multivitamin is a great place to start.
Gummy okay?
Sure.
Okay.
If it means you'll take it, I take one that does not taste good.
If I'm 44 and they're Flintstone vitamins, is that okay still? Or,
If they're have the right amounts, maybe.
Right. Now this is in addition to a good, well-rounded, healthy diet. A multivitamins not going to replace a poor diet. So you have to have a good diet. A well-rounded multivitamin that's specific for the age is a great idea. Vitamin D supplementation, again, make sure you don't get toxic with it. But there's value in knowing what your baseline vitamin D level is when you start it. If you're deficient, severely deficient, taking a daily low to medium dose isn't going to replete that deficiency. It's just going to help maintain that deficiency, if you will. And I can talk about that a little more in depth in a while. But again, a good probiotic is a good place to start for people if they have that need. Probiotics are kind of the Wild West in supplementation. So there are your fresh probiotics, often the refrigerated ones tend to...
Kefir, yogurt,
right.
or the shots.
And there's some brand names that I recommend to patients, but they're maintained in a refrigerated environment at the pharmacy. If you get something on the shelf at a dollar store, it's probably not worth your money. Right, and they're all dead. So, but the good probiotics, and like you mentioned, some of the Greek yogurt, your kefir, some of those are good. Beyond that, there's some more niche vitamins.
Fish oil.
Fish oil is wonderful.
CoQ10.
Yep, CoQ10. Okay. When it comes to most of my patients, when they have an established vitamin D deficiency, if I put them on a daily supplement, let's say 2,000 international units, that's going to do nothing to replete that deficiency.
Okay.
So the standard of care is to give somebody a high dose vitamin D. I usually use 50,000 international units once a week for, say, 8 weeks, recheck their vitamin D level. And if it's not yet back to a normal, healthy range, give them another round of 50,000 once a week for 8 weeks, recheck their level. And again, this isn't medical advice. Rather, it's just a framework of how I practice medicine and help to replete deficiencies. Once I get that vitamin D level repleted, then I put them on a daily vitamin D3 at around maybe 2,000 to 5,000 international units daily. And then regularly, maybe once a year, check those labs to make sure that we're maintaining that. The analogy I use with patients, if they come in and their swimming pool is empty, that swimming pool is leaking 20 gallons of water a day. If I add 20 gallons of water a day, I'm doing nothing to fill that deficiency or fill that pool.
Right.
I'm just keeping up with the loss. Now, if I put 35,000 gallons of water in to fill the pool and it's leaking 20 gallons a day and I'm giving them 20 gallons a day, I'm helping to maintain that level.
You replenish,
in that pool.
Then you maintain.
Exactly.
And just so everybody knows, I mean, I was told that I needed to supplement with vitamin D because I get sad. I get sad. No, seasonal affectiveness disorder. So in the winter, like you said, in the Midwest, we don't get a lot of sun. And so I've had several doctors tell me that in the wintertime, they tell their patients to supplement with vitamin D. But it's good to know that I should have gotten a baseline first.
Exactly.
To see where I'm at.
Exactly.
And that's something I'd have to advocate for myself. Because that's not something somebody normally tests for.
Exactly. And that's something that we test for at Limitless Male because we do offer vitamin D therapy in a responsible, monitored environment.
Right.
Now, if you're not on vitamin D and you're not going to get it checked, it's probably not going to hurt most patients to take a supplemental vitamin D. But don't be surprised if you're not going to see a profound effect because you may have that empty swimming pool and in need of high doses for a while to replete your deficiency. Then it can substantially help your mood. Now, I say that. The research is not all that conclusive on how well it helps mood. Some people take vitamin D and swear it helps aches and pains and that generally just not well feeling, if you will. One memory stands out to me in medical school on my rheumatology rotation.
We've all been there before.
Yeah.
The old
I know, right?
Rheumatology
I know, right?
rotation.
It's like a common experience everybody's had. So we did whole day fibromyalgia clinics.
And that's
you want to talk
phantom
about
pain.
Yeah, hurting at the end of the day. Boy, listening to people talk about fibromyalgia all day, you're going to start feeling it at the end of the day. But what was very interesting to me is these rheumatologists I worked with on their initial visit would place patients on vitamin D, replete their levels, have them come back. And I was shocked at the number of people that came back and said, "Doc, I feel great. I no longer have the achiness. My mood's better. See ya." So these are people that their primary care doctors were concerned about having fibromyalgia, but really they had vitamin D deficiency. And once the rheumatologists discovered it, repleted it, the patients felt fine.
Interesting.
So potentially saving these patients years of fibromyalgia medication and all that
drug
that brings.
seeking,
right? Exactly.
Discrimination and all of that kind of stuff that comes with fibromyalgia. Quick fire. I used to wake up with morning wood. Now I wake up to joint pain and kids screaming.
Oh, you got my message.
What's changed? So that kind of goes back to our functionality. If I don't wake up with morning wood anymore, what's the problem?
Early on in my practice, what the analogy I use that made it stick with men on the importance of erectile health is the penis is the canary in the coal mine. If you think back, miners used to take a canary down to the coal mine with them so that when carbon monoxide levels rose to a dangerous level, the canary would die first, giving the miners time to get out and save their lives.
I thought it was the canary got a massive erection, and that's how they knew.
So in my analogy, with the canary in the coal mine analogy, the penis is the canary in the coal mine with respect to their cardiovascular health. So it's the outward manifestation, if you will, of your cardiovascular health. The penis is comprised of blood vessels. And the responsiveness and the health of your blood vessels in your body is going to be the same as what it is essentially in the penis. So if you're seeing erectile dysfunction, then that tells me how overall your cardiovascular health is doing. And when we improve those risk factors, obesity, smoking, diabetes, hypertension, hyperlipidemia, we can improve erectile health.
So back with the canary in the coal mine, one of the questions was basically,
Canary Boner sounds like a good band name too.
That actually does. Can stress actually kill your sex drive, or is that just what we tell our partners?
No, it's absolutely true. Absolutely true.
So your brain
can sex kill our drive?
can stress.
Stress. I think you said can sex.
No, can
okay.
stress kill your sex
Oh,
drive?
yeah, absolutely.
And it's like if your head's not in it, you're done.
Yeah.
Right.
Okay, so it's a canary to your circulatory system, but then also maybe your mental health.
But the earlier question was with respect to morning
wood
erections.
only.
So when you wake
Those
up
are
in the
those
morning,
spontaneous erections.
right? So exactly,
Purposeless.
Purposeless
that's
spontaneous
why
erections.
they're important. When you wake up in the morning, your stress level's at its lowest, and your testosterone is at presumably the highest it's going to be for the day. So if you're given a situation where you have the lowest stress and your relatively highest testosterone level for the day, and you're not able to get your morning erection,
Ding, 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 ding.
exactly, something is wrong with
So
the patient.
should you take care of that morning wood every morning? What would you
just
recommend
let
as a
it-
doctor?
That's a good question.
Is it healthy or not healthy? I just had someone tell me, like, oh, you should try giving up sex for 30 days. The athletes do it. And I'm like, that's a myth. Like, what? That's
That's a
what
good
do you-
question.
like-
Is like the prevention of, because you're wondering, is the prevention of ejaculation a good thing?
or just having an orgasm, like, because orgasm is healthy for you, it's natural. So, like, how could that be bad to withhold having an orgasm, especially if you're getting a healthy morning wood
Doc,
as a canary?
Well,
is there anything downside to releasing the
You
canary?
know how many men right now are
morning?
watching this? They're going to go, "Sorry, honey, but the doctor said."
well, if you wake up and you're taking a nap on the subway, it's probably not a good time.
Oh, yeah. Ooh.
Probably not.
Yeah.
Yeah. But if you're just at home,
Home in your bed.
in your bed,
Smoke them if you got them.
is stretching overrated, or am I just lazy?
No, it's absolutely essential. Let me preface that, though. If you're 20 and you're watching this podcast, the 20-year-olds can hit the gym often, start lifting weights. They're done. They feel great. They're not going to injure themselves. So if you're young and have that vitality, God bless you. You could probably get by without stretching. When you're like me, north of 40, it's going to be absolutely essential that you incorporate some stretching. The research shows it helps to reduce injuries during exercise, and stretching afterwards can help with the delayed onset muscle soreness as well.
So talking about TikTok, what I love and what I've been doing more, instead of just lifting weights or doing cardio, they talk about it training like a spy or a ninja. And it's doing stretching and working with your hips and doing things and going down and up, because you're training your body in different ways that it's not used to for that same flexibility as you age, especially in your hips and your joints. So you get your stretching and your exercise at the same time.
That would make stretching more fun if I thought I was like training to be a ninja.
You know, it's kind of cool. It's kind of a cool idea behind it.
And I'll attest things. I've had 8 surgeries on my body, like from shoulder replacements to back, hand, everything. You know, so whole new face. It was John Travolta and we traded.
I was gonna say
that was
you
one
do
of
a
them.
Face-off thing.
We did have a face-off. But I started doing, as I had some health issues, I started doing, getting back to a nutritious diet every single day, making sure I eat meals, number one, but making sure they're healthy. And then doing stretching every morning. And so usually I get up, you put the playlist on, and it's like stretching. And I do a lot of dancing to make it fun for myself, naked.
Whatever. Okay.
While all the other old ladies who live across from me watch. It's kind of our thing. But I'm not gonna take that moment away from them. Okay.
They got dollar bills,
They
might as
need
well.
it. They
Dollar
need it.
bills, exactly.
But you're right. It does.
Tough economy.
It also, I would say, has the biggest impact on your mood and your like mental just
Stretching.
sharpness, and you talk about stress. Stress has been my like near killer in extreme stress.
A lot of us.
So you get up in the morning and like, okay, I'm good, I feel good, and then you check your email and it's bing, 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 stress bomb,
Yep.
and you're filled with anger and tension, and like to the point where I literally have been in and out of the hospital because my blood pressure was 205 over 125 for a good 2 months. That's not healthy.
Yoga and meditation has been a lot of fun with that, or a lot of
It helps you like prepare your mind and body for the impact of stress. You're going to have stress things that the triggers, but you can prevent how it happens, I think, just by doing stretching exercises, and in the morning, especially as you start your day.
Yeah. So I do want to ask you about one of your favorite peptides, but first, what the heck is a peptide? What is it? And I have a good answer for this, but I'm going to ask you first. What is a peptide?
And again, back to the discussion of TikTok, that's another thing that you'll see more prevalent on the TikTok feeds are discussion of peptide therapies.
Peptides.
So it's something that we specialize in at Limitless Male Medical Clinic. So the definition of a peptide, they're short chains of amino acids between about 2 to 50 amino acids long. So that's what we consider a peptide.
And
if it's longer than that, it's considered a protein.
Okay, I was going to say, and aren't they building blocks of proteins?
Exactly. So a dirty definition would be a really, really short protein, but protein.
So I like your dirty definition better. A really, really short protein. Okay.
I'm lost.
It's not accurate because a protein would be greater than 50 amino acids long.
I'm dumb. I don't know what a protein even is. So are we talking like this is like similar, the same, not at all the same as like the hormone treatment? Like where's the peptide fit in that?
So yeah, peptides, again, they're arrays of amino acids that can have a physiologic effect in the body. They either mimic our hormones or they influence our hormones in some way.
Oh, gotcha.
So, fun fact, one of the oldest peptides that you know of is insulin.
Really? Okay.
You've heard of that, right?
Yeah, I've heard of insulin.
Everyone has heard of insulin, and it's one of the original peptides that was discovered. It was the OG. And so when everybody asks me what a peptide is, I'm like, well, did you know? They're like, oh, well, it's this new medicine. No, not really. We're just now talking about it.
Exactly. A new, old term that has gained new notoriety, if you will. So some of the newer medications, more exciting medications, are peptides. Exactly. So your medications like tirzepatide or other forms of peptides. The PT-141 that we talked about earlier are peptides.
Is it technically even a medicine? Because I've gotten a couple arguments from people who are like, no, I'm all natural. And I'm like, this is something your body produces already that you don't have enough when it comes to like hormone treatment, but peptides would be similar in this discussion, right? Like, is it really a medicine or is it just supplementing what your body would have normally produced on its own that just can't anymore?
That's a good question.
That's different than a medicine to me.
When it has a medicinal or therapeutic event or effect, I think that one can consider it a medicine.
In terms of, I see where we're going with it, it does feel more natural. It's not it may be a synthetic product sometimes, but it's still something that your body uses and needs. It's not trying to put a new foreign chemical.
I think a lot of people have that hang up of like, and I do too, with antidepressants, like the studies they show, they only last 18 months. So it's like, it's not even a long-term solution to my depression. If I have, say, hormone replacement treatment, when that was causing the depression was the deficiency in my own testosterone, that's a different thing. And that's something my body produces naturally. And I think rightfully so, I think people are skeptical of, hey, just take this pill and you're good, or this medication.
I certainly think that there's nuances to the discussion. So one medication that we often use at Limitless Male is a medication called gonadorelin. That's an injectable medication that can increase natural testosterone production from your testes. So the testosterone increase that a man sees is natural because it came from his testes. However, it came about from this stimulating hormone peptide, gonadorelin. So I guess what shade of gray you're looking for in a definition.
Yeah. Speaking of shades of gray, I'll ask my favorite question, my last question. What is NAD plus?
It's a peptide. It's NAD functions in the electron transport chain of our cell. We all learned about the mitochondria when we were kids.
Little spindly
things. The powerhouse of the cell. So as we age, we lose our natural NAD. So
it's something that we have in us.
Exactly. So whether you take an NAD precursor, like we talked about before the show, or do injections of NAD or infusions of NAD, you can improve the NAD levels within the mitochondria. So that helps with endurance, performance. There's also reported benefits in cognition, so many areas.
So many. Anti-aging.
Right. Anti-aging is kind of the umbrella that we put it in.
Thank you so much for joining us. That was thoroughly entertaining, and I think I learned a few things. So, Matthew, always a pleasure. Dr. Miller, thank you very much.
Who knew canaries got erections?
Purposeless erections.
Purposeless erections.